Fun, fun. We are fine, fun in school. Fun, fun. We are fine, fun in
Malawi is 20% urban and 80% rural. Most of these people that are in the rural areas are in abject poverty. So disabled people that are from these rural people, they struggle a lot.
They are very poor families. They can't even able to get a living or to find food for them and for their children.
Most of the parents do not accept that they have a disabled children and they have to take care of the disabled children.
Many parents, they don't disclose their disabled children to even to hospital, even to other people. They feel shame of themselves with the children.
Most of the moms, the husbands run away when they get a disabled child. And for a woman to take care of the child, she has so many problems.
Some of the parents are ashamed because they have got a disabled child. So they lock the child in the house because they are ashamed.
They actually forget about the disabled ones, that they also need their support.
They find it as a burden to them. It's like they ask themselves questions, why is it that God blessed me with such kind of a child?
They have a negative attitude, so they just ignore them and concentrate on other children.
Some are locked up the whole day. Some are denied food. Some are not treated as human beings.
They have problems of malnutrition. They have bed sores because of sleeping the whole day.
They are failure to thrive. They need psychosocial support always. They always need someone to be beside them.
Isabel is 6 years old. She was born disabled. She cannot walk and she is dumb. She has suffered from malnutrition 7 times. And apart from treatment for this, the family has no support. Isabel is looked after by her grandparents because her mom has malaria.
Some moms don't take their children to hospital because they don't know where to go, or it's far from home to hospital.
We depend on main buses. So if they don't have money, they will not go to the hospital for treatment.
Chikulani is 4 years old and has hydrocephalus. His head is very heavy and he cannot sit unassisted. He cannot walk or see, so needs a lot of care. His mom has always to be with him, and so she struggles to do what she needs to do. She finds it difficult to provide for her family.
We have a long referral system. When we discover a child, for example, with hydrocephalus, from John Day, we refer them to Mulanje District Hospital. From Mulanje District Hospital, they go to Queen Elizabeth Hospital. So they need at least 8 times before they get treatment.
For a parent to get money for transport for all those visits, it's a problem to them. And sometimes they decide to leave without being helped.
The parents need money, of course, to be able to reach the district hospitals. For a parent to reach as far as Blantyre to get help, maybe for example BedCure, which is a hospital that deals with bones, to children that have got difficulties in mobilities, it becomes a challenge.
Wilson is 6 years old and was born with 2 deformed feet. When he was a baby, he had an operation on 1 foot, but there were many visits to hospital. The operation is free, but the transport cost too much money. Now, his dad believes that the bones are too mature to be operated on. Wilson walks to school, but struggles because he has sores on his foot.
Those people that have got mobility problems, they might want wheelchairs, they might want assistive devices like pair of crutches.
Some need walking sticks, others sandals because their feet are deformed.
Sometimes after assessment, they need operation and then thereafter they can walk.
The mom can carry them when they are young, but when they grow, it's a challenge for the mom to carry the children for school. Some women who are eager enough, they take their children But the problem is that the mother stays at the school from the time the child goes for classes and waits until he goes out of class back home. The rest of the family lacks the mother care.
Milda is 10 years old with hydrocephalus. She goes to school because her mom carries her to and from school every day, but she is getting older and heavy. To earn money, Milda's mom works on other people's farm, but the work is very far away.
For hydrocephalus, they need urgent removal of cerebrospinal fluid.
Most of the children who have gone earlier and follows the hospital instructions are healed, and the mothers have no problems.
It is also important to give education to people to seek medication whenever they feel sick, because diseases like malaria or measles can also cause disabilities.
Yvonne had meningitis when she was 4 months old. This left her not able to walk. She is 14 years old, but does not go to school because it's very far away. She is too heavy for her mom to carry her. Yvonne's dad died when she was 6 years old, so her mom is alone taking care for her.
A majority of parents here, they are not educated. Okay, they didn't go far with their education. So they don't know what happens when they have got a disabled child. They are isolating the child. You find a majority of them complaining that I'm being isolated, I'm being discriminated. So the discrimination itself starts within the family. So if the family is discriminating the child, even the society can.
Masauko is 15 years old. He is dumb because he had an illness when he was 2 years old. He has a close relationship with his grandmother, but he gets frustrated and aggressive because he cannot communicate.
The parents need to stay closer to the children so that they can understand each other. So that as they are doing the sign languages, even other people can emulate what they are doing, so that the child cannot feel isolated.
Masauko does not go to school. He would like to go to school where they can learn sign language, but it's a residential school, and his family cannot afford to provide him with his own blanket, clothes, and a bag. He shares these with his brothers.
In Malawi, we've got a few schools that offer education to those that are blind, to those that are dumb. So people to move from their different areas to these places, it becomes a challenge. Therefore, these people from poor families, they don't have access to their education. And because of this, they can't take their rightful places in society.
Laston is 12 years old. He was born okay. He had an illness and fell unconscious when he was 3 years old. This left him blind in both eyes. He has been referred to hospital, but he cannot make his appointments because the family do not have money for transport. He is isolated because he is not in education.
If we give opportunities to someone who is blind, this person can get education like a normal person. And in the end, this person can function or can help develop this country like any other person.
Mele is 16 years old and goes to school, but she struggles with her studies because she has difficulties reading books. She needs glasses to read, but her family cannot afford to buy them. She has repeated her school year 3 times. Now her family will stop paying school fees for her because she always fails.
Most of the children who don't see properly don't progress in school, and they even drop out because their friends laugh at them. They don't gain what they are after, and they are mostly repeaters. They repeat the class for 4 times without getting anything.
We are trying to help disabled children in all levels, because we are looking at the psychological part of it, we are looking at the economical part of it, we are also looking at the educational part of it, and even the social part of it.
What we are doing and we are aiming to be doing is to make sure that all the disabled children are in school.
Of course, some other children will not be able to go to school because of their disabilities. But if we assist the family, they might be in a position to assist the child in other ways.
Like taking them to hospital so that their health at least can be better than how they are just now. We are trying to do this because most disabled children are coming from very, very poor families.
We have visited 45 villages looking for these disabled children. Out of these 45 villages, we managed to come up with 250 disabled children.
We thought of gathering all these children at one place so that the children, their parents and the chiefs should know what we'll be doing in this project. And also for those mothers who are having disabled children to know that there are also other parents who are having disabled children, even of worse condition than their children. There are still other people who are thinking of them, who can assist them.
We had examples of what mothers can gain if they work so hard in helping their child to go and access education.
Irene was born perfectly, but at the age of 5, she had measles. That measles made her being disabled with a lame leg. When she was in primary 5, she got pregnant. Because of her early pregnancy, she has a fistula. So many children were not liking her because always her dress was wet and she was smelling. Her education was then affected. She was about to drop out from school. So after we discovered her, we took her to hospital where they treated her. Now she is comfortable in school because she can be in school clean the whole day without getting her dress wet.
Rebecca, who has been assisted with a wheelchair, was born normally. After some illness when she was 3 years old, she got malaria and got paralyzed. The mother was carrying her to school and she was not herself because she was on her mother's back. But now as she is on a wheelchair, she is liking school and in class she is doing better.
14.
Bridget was born with a disability. Her disability is that she can be able to use her legs, even her back it's weak, so she can be able to walk, even to crawl. She just sits down, but she's a very clever girl. Her mom used to take her on her back every day to school and from school. Then we thought of an alternative way. We bought her a bicycle, a strong bicycle with a basket in front. As of now, Bridget's mom is taking Bridget to school using that bicycle. This bicycle not only assists Bridget, but also the mother and the family, because when Bridget is out of school, they can use the same bicycle to learn a small business.
We are targeting all categories of children that are disabled, those that are mentally challenged, physically challenged, those people that are albinos, epileptic, and even those that have got body disorders. For example, we talk of hydrocephalus as a body disorder.
We are also planning to be supporting these parents in their homes, maybe with some business, or to train them with the ways how they can be getting money to support their family as well as the children.
After they have done businesses, they'll be in a position to assist the child to go to school. So we need the child to attain higher level of education, not only primary and secondary school.
And they have to have an opportunity to get to college. They have to get an opportunity to go to the universities.
After they have gone into the college, they can get a job somewhere. They can be employed. In that way, they'll be in a position to assist other disabled children in the society.
We have organized health education for teenage girls and those people who are of childbearing age, expected mothers, mainly because we know some of these conditions come because of lack of nutritious food.
Education is the key to everything. I mean to everything: knowledge, economic empowerment, social empowerment, moral empowerment. This all boils down to somebody's education.
We need to reach to the masses. A majority of them needs to be included in the schools. A majority of them needs to be assisted economically. A majority of them needs to be assisted with mobility aids.
When the disability is being discovered early, there is hope for these children, because if they are taken care of, they can go to school and they can become better citizens of Malawi.
If we leave people with disability behind without giving them education, it means we are pushing development behind.
I hope that as we are going with this organization, I hope that we are trying as much as possible to alleviate most of the problems that disabled children have in the society.
We are having some of these disabled that have been sponsored already, and we hope that we'll have more sponsors that can come in and to support the project, and these disabled can have a change in their lives.
If we take care of disabled children, there is hope for them.
We cannot support them on our own. We need sponsorship.
We need support from well-wishers so that we can continue assisting these people.